Hello everyone, welcome back to the channel. It's me again, Kresnik. It's been a while since I made a video for you. Well, it has been a busy couple of weeks for me, and work has been work has been hectic, and there's too much to do. So I only got time today to make you a video. The video I prepared for you is about Camel Dystocia, and yeah, it is an unfortunate event for the mother, the camel cow. But however, I want to share it to you just for you to have a knowledge on what it is and how it's done, and how we help the animals, and how we can prevent and if we can avoid it. So I prepared some notes that I want to read to you about this video. So first off, let's define dystocia. So in simple terms, it's prolonged labor, or simply obstructed labor. So I identified several factors for you, what causes it, and so just the main, or from my experience, the factors that affect dystocia. So first off, it's the of course, it happens when the fetus is trapped in the cervix or in the uterus, and one of the reasons may be the position of the fetus. So maybe it's sideways, or one of the legs or one of the arms is out and the other is caught inside. And another factor is, a big factor is the size of the fetus. So if the fetus is big and the pelvic canal of the mother is small, so that will be a huge factor for dystocia to happen. And then also on the mother's side, it's there's no dilation of the cervix, and also the fetus wants to descend already, but the cervix did not dilate immediately. So there's slow dilation of the cervix as well. And then other factors may be obese mother, the cow or the camel cow is overweight, and some other environmental factors like stress or or maybe injuries. So those are some of the common issues that I experience when it comes to dystocia and why they happen. And then yeah, in the case that we have for this video, the position of the fetus is in breech position. So what is it? What is breech position? So basically, it's the rear end of the fetus is presented to you when you see the fetus. It's you can immediately catch or hold the tail and its pelvic area, and in this case the hocks, they're outside already. That's for this video, that's what we can see on this case. And then for breech position, usually imagine the animal on a seated position, so the hips and the legs are flexed. So that's how the fetus is positioned towards the birth canal. And yeah, that position for this case, without the hump of the animal, it will be simple for the animals to inject to the fetus. But however, because of the hump of the fetus, it's blocking, it's trapped inside the birth canal of the mother. So that's why it's having difficulty giving birth. And then yeah, for this instance, how do we remove the fetus? Well, of course, you have to examine first which part of the animal is presented in the uterine or on the birth canal of the mother. So there are animals that you can manipulate the position of them, where you can correct the position, put the head towards the birth canal so that you can pull the fetus easily. But just it's a big but in camels. As you can imagine, they have long extremities, so they have long legs, long neck, and that is not possible here. Plus, the weight of the mother, the intestine, the stomach, everything everything is pressing towards the uterus. So it's really difficult to manipulate it. So in this video, as you can see, we did not do any manipulation at all. So for this case, I immediately decided to use a rope, tie it on the hocks so that we can eject the fetus immediately. So I can say that in this instance, I've seen other cases of dystocia, but in this instance, the mother is a little on the side of luck, because we can immediately remove the fetus. How and why did I say immediately? It's because like I said, it's in a sitting position, so there's no the legs are both flexed and are presented already outside. So all I needed to do was to tie a rope on the both hocks and then apply lubricant gel on the side of the pelvic canal, so that it will be well lubricated as we carefully pull it with the help of our two helpers. And then one doctor, my supervisor, he's the one holding the vagina so that it will not evert out. So just also not to cut the perineum of the animal. But then again, because of the hump, this animal, the fetus, is presented the way that like a sitting camel. So the hump is facing on the upper part of the pelvic canal. So when we pulled the fetus, the hump cut through the perineum. But that's okay, because we can easily suture it. So as you can see on this video, me and my supervisor, we sutured the perineum and the part of the vagina that got lacerated as we pulled the fetus out. And then a bit of caution, if you will be doing this on your own, after pulling out the fetus, you have to make sure that the placenta comes out as well, and then make sure that there's no bleeding inside of the uterus. So check for bleeders. Immediately check inside. Use a flashlight if it's nighttime, or if it's daytime, you can see it properly. But do not leave it immediately. Do not leave the dam or the camel cow immediately. So just leave it for a few minutes sitting, and then observe if there will be any bleeding, because this kind of thing happens to dystocia cases. So you have to be very, very cautious about it. And then if you are in doubt that there is any bleeder, if you have any vitamin K with you, as we do, we have that prepared all the time if we have these types of cases. And we have sutures, absorbable sutures available, ready, so that we can, if there will be any lacerations like what happened to this camel, then we can immediately, address that problem. And then, of course, it's always good that you have anti-inflammatories and your broad spectrum antibiotics ready. And broad spectrum spray as well will help. All right, prevention. I want to talk about prevention. So how we can prevent it? Well, avoid breeding, heifer camels. Just let them age about maybe 3 or 4 years old, and then have like they're mature enough or big enough to handle pregnancy. And then of course do not check the history of the sire, the bull, if that's possible, because sometimes it isn't possible to check the history of it. But if you can check the history, if it has history of dystocia or some similar case, so avoid that. And as you know, there's no way that we can really know if the animal will be if the fetus will be in breech position or in the correct position when it's time to give birth. But what we know is that when the animals are small inside the uterus, they move a lot. And then on the time of parturition, nearing the time of parturition, that's when they position themselves towards the birth canal. And if the animal is not too big, it can pass through immediately to the birth canal. So again, the sire will play a role in this. And then also nutrition. If the mother is not too fat, then the animal can give birth easily. So I hope that this will teach you something if ever this kind of case will come your way. And so I want to say goodbye, and I hope you enjoyed the video. Please subscribe and like. This will help my channel to move ahead and move forward to other people who wants to also learn. So see you on the next video. Have a good one.